What if the biggest breakthroughs in healthcare didn't come from billion-dollar labs, but from bold choices about affordability, access, and systems? In this episode of Build with Shreya, we spoke with Arushi Jain, who brings together finance, law, and pharma to lead strategy at Akums, India's largest CDMO, and previously founded a generics first pharmacy chain to make medicines more affordable across the country. And if there's one idea that runs through her entire journey, it's this: healthcare doesn't scale through products alone, it scales through systems. One of the most powerful moments in the conversation is when Arushi talks about silent innovation. Her example is a drug for sickle cell anemia, a rare disease where treatment used to depend on expensive imported medication that had to be stored between 2 to 8 degrees.
A medication used to be imported that was very, very costly. So, our R&D team, after we identified this gap, and we started working with the government mission, and so our R&D team silently got to work, and they developed a solution which is not only affordable, 1/100th of the cost that we used to import, but also it is stable at room temperature. The earlier medicine used to be stable at 2 to 8 degrees, and it is not easily transportable, especially to tribal and rural areas where the sickle cell is most affecting people. So this was a revolutionary drug that we were able to develop.
It was picked up organically, shared by the health ministry, and scaled across state governments. This wasn't innovation for attention, it was innovation for access. At Akums, scale doesn't mean more factories. It means more coordination. With 15 plants, thousands of SKUs, and over 1,500 clients, the challenge isn't production, it's alignment.
So definitely, managing the scale requires us to not only work on a lot of policies, procedures, but also it's how we enable all of these processes through technology, and how we bring technology and use it now more than ever. So we look at every process, be it production planning, manufacturing, legal, finance, accounts, everything, and we see how the workflows can be automated.
Every function, from manufacturing to legal to finance, runs on integrated digital systems. ERP systems connect decisions from the shop floor to the boardroom. The goal isn't just efficiency, it's visibility. Because when everyone sees the same data, decisions stop being reactive and start becoming strategic. Pharma doesn't operate in one regulatory world, it operates in many: US FDA, EU GMP, TGA, domestic regulators. Instead of treating compliance as an audit exercise, Akums treats it as a mindset.
I think training is also very important. So we constantly train our people, especially on the shop floor, to kind of update them, revise everything, bring everyone on board with the updating vision of the company time to time, and new systems and technologies that we keep bringing in.
In Arushi's words, compliance only works when it's built into the daily rhythm of work, not enforced from the outside. Arushi sees three forces reshaping India's role in global pharma. First, the China Plus One strategy is pushing global companies to diversify manufacturing. India is emerging as a natural alternative. Second, government focus on local API manufacturing is strengthening the entire value chain from raw materials to finished formulations. And third, the industry itself is shifting from being seen as just a manufacturer to becoming a co-creator and innovator.
India is one of the largest, exporters of pharma generic even today, and I think after the China Plus One, strategy that a lot of global companies are now employing, India is on a much more stronger advantage to kind of gain a bigger share of the pie.
The industry needs over 100,000 skilled professionals across R&D, QA, manufacturing, and compliance. Which is why Akums has invested in skill development centers, training thousands of workers, not just for the company, but for the ecosystem. If Arushi could redesign the ecosystem from scratch, she would focus on three things: stronger IP protection, so innovation is rewarded; deeper collaboration between industry, academia, startups, and government, and a massive push toward building T shaped talent, professionals who understand the full system but specialize deeply in one domain. Because the next phase of pharma leadership won't come from scale alone, it will come from capability. Arushi Jain's journey shows us a different model of leadership, one that doesn't chase visibility, one that focuses on systems, not spotlights. So, if you're building in healthcare, in technology, or in enterprise, ask yourself, are you designing for attention or for access? Are you shipping products or building systems that outlast you? Because in the end, the most powerful innovations are the ones people don't notice. They just live better because of them. Subscribe for more builder stories and share which insight from this episode stayed with you the longest.